One of our secret of success is working for the community and in the community.
With a common goal to deliver villages and communities free of avoidable blindness.
To bring eye care right down at the rural areas where it was never available before.
The understanding of the culture and the individuals on a personal and an individual level. And how can you best serve people that you're working with?
See, all of us has to join hands and try to eradicate this blindness.
It's fitting to be at First Baptist Church because this is the center and the start of Operation Eyesight. It wasn't called Operation Eyesight at the beginnings. It was a group of men from this congregation that made a club. They called it the Ben Gollison Club. Ben Gollison went to India as a medical missionary. He was a doctor, thought he'd be doing general surgeries and service and attending to illness. But there was a tremendous need to cure curable blindness. So when he came back to Canada, he was on a mission and he came to First Baptist and spoke. The need in India was so great that they just thought, restoring eyesight will help these people to, again, work, provide for their families. And it was, you know, men, women, and children who needed their eyes. And they decided to have a fundraiser. Dad was president of the Baptist men in this church, and he challenged and got some of the businessmen in this church together. And big success, they raised $840. They thought, well, this is wonderful. And that would be the end. But that wasn't the end. And it just continued and continued to grow.
Started in 1963, and Dad went in 1968, paid his own way, but he wanted to see that donors' money was going to where it was supposed to go and doing what it was intended to do. One of his most moving stories when he came back, there was a baby who had congenital cataract, and Dad was there the day they took the bandages off his eyes, and the child looked at his mother for the first time and could see his mother. That was probably the most emotional event for our dad.
Well, we're biased, but he's a visionary. She saw the need and knew that it was outreach. He brought in a strong support system of volunteers that helped continue and enjoyed working for him.
He would always acknowledge Mom. Anywhere he spoke, he would say this never would have happened without her support.
His hope was that one day the elimination of curable blindness would be achieved, and that was his goal, always. As we know today, that hasn't happened, but every little bit helps, and Operation Eyesight is certainly contributing to that.
We are now working in about 10 countries in South Asia and in Sub-Saharan Africa. We have now the identity of well-meaning partners, friends, supporters. Reaching the unreached is our mission. They know that we mean the best, and we only mean to be there with them so that they take care of the needs, problems of their own people. And it is a fairly decentralized organization now. So the decisions are made by the local country program teams, no more by us in Calgary office. So as a result, it is contributing to enhancing the efficiency with which we are able to deliver results. It is about empowerment of the target communities. So we enter into partnership with the local communities, so be they partner hospitals or even the target communities or the leaders that you have at the village community level, and make sure that the ownership related to eye health is transferred to them. So that's what we do so successfully, and that's how we have gone about scaling up. Again, it has been a wonderful experience, evolution that we have gone through.
To me, is what we do with relatively small group, but the partnerships are incredible. And what we've done is now replicable, so it can be used and repeated over and over, and the solutions are permanent. We go to certain countries and there'd be connections with local governments, higher levels of government, other organizations that are doing great things, but not in a competitive way, more of a collaborative way with respect to education, development, water, all these areas that were impacted through eyesight, which is, I think that's kind of the biggest benefit. Is it's an eyesight organization first and foremost, but it's on a bigger scale, a development organization.
Operation Eyesight started working in this area since last 2 years with the help of our partner hospital, Chandraprabha Eye Hospital. We have come from Jorhat. It is almost more than 40 kilometers. It took almost 1 hour. So we park our vehicle. Now we're crossing the Brahmaputra River. It's a small part of Brahmaputra River, actually. We have 9 people. And in the middle of the Brahmaputra, there is small Iceland. So one of the village name is Kasikata, which is about 10 to 11 kilometers from that point of river bank. We have informed the people that today we are going to organize one screening camp. So they are waiting for us. Those people who are living on the Iceland, it is very difficult for them to come to the main towns because it is too far away. But in monsoon season, when the flood comes, it is very horrible condition out here in Majuli. Everywhere is flooded, lots of cattle died. People also sometimes get died. Their life is very difficult. No other job opportunity, no other income sources, nothing. They are only dependent on farming. And farming is the only source of their income. For even their clothes, for even buying 1 liter of oil, they have to travel 5 kilometers because there is no shop. The people who are working here, they only realize how difficult their life is. So when we come here, first time, we are surprised to know that there are more than 25,000 population in these areas. But there is no doctor, no eye camp, nothing. It was zero, totally zero. We have seen many patients who maybe died with their blind condition. So initially we have appointed one community health worker. He covered all the areas, even go to house and find out and identify those people who need the eye care. After that, we started organizing the screening camps so that people can be identified and diagnosed with the eye diseases. And those patients were bring to the hospital for the further surgery and further treatment. Till now, more than 10 villages we have declared from this area of Majuli as an avoidable blindness-free village. In our development sector, we generally say that we are working in the last mile. So, but it is the reality. We are working really in the last mile. But I'm very happy that with the help of Operation Eyesight and with the help of donors of Operation Eyesight, we are reaching to those people to give the eye care to this area.
Narok West Sub-County has the highest prevalence of trachoma, which is 19%.
The bacteria which is responsible for the disease, Chlamydia trachomatis. In the world, it is the second largest cause of irreversible blindness.
We work closely with the Ministry of Education, who assist us to recruit the head teachers and also the health club patrons through a training where they were able to understand what trachoma is and how it is prevented, how it is transmitted, and how we are able to eliminate the disease.
And that's why we study in the school here, to try to teach them, the young generation, if we use toilets, we eliminate the trachomas. If we use water to wash ourselves, we eliminate the trachoma. And since this one has started here, it took us for 10 years now, and it's 100% no trachoma in this area.
Operation Eyesight was able to provide them with murals and also hand and face washing kits.
And when children were trained, they learned the importance of cleanliness of their environment and cleanliness of their face. And the most important thing was to eradicate trachoma, which I can say and I can confess has reduced in our school.
By moving closer to the Operation Eyesight, we are screening, trying to minimize the blindness in children.
Before I could not see well, but now that I have got my glasses, I could see very well more than before. Before I used to copy from my friends the notes that we used.
Recently, I was trained by Operation Eyesight to screen learners with visual impairment using peak acuity. We have gone to various schools creating awareness.
If a child is found with a bad eye, this child is referred to the clinic, and the child is given a medication, and it is from there that our children are able to read.
I feel that learners who are not able to see, when they were given the eyeglasses, they were very happy because the self-esteem was raised up. They had now the confidence even to socialize because their performance has now improved.
Now that I can read and see well, I hope I will be able to achieve my dream to be a designer when I grow up.
Operation Eyesight has been in Ghana since 2009.
Operation Eyesight came because there were quite a lot of diseases, eye diseases in the country. Talk about cataract, talk about glaucoma, talk about trachoma, onchocerciasis, childhood blindness, refractive error, among others. And those are areas that they were already working with other partners in other countries. So their expertise were already there, and they felt that they could help the country.
With Operation Eyesight, our main thing is to work as close with the government as possible. Most African countries, the government owns more than 70% of all the health facilities in the country. And that has helped us to develop sustainable programs.
The focus has been in terms of supporting Ghana Health Service to achieve their strategic objective.
The majority of people who need the service of eye care are not getting it because the human resource that we need.
Before we had this Ghana blindness survey, we really hadn't done any survey, any baseline study on blindness in Ghana.
We didn't have the figures or the survey that tells us the burden of the conditions that we have. But Operation Eyesight came in and said, no, before we can even know what we are doing, we have to go to the field.
The need for data was paramount, but then Ghana was relying on WHO estimates.
So we realized that we had only about 2 or 3, not many, eye indicators in the platform that actually generates data for the country. So Operation Eyesight Investor helped the country through IAPB, International Agency for Prevention of Blindness, to help us to develop new eye health indicators.
Operation Eyesight partnered with another NGO, the Swiss Red Cross, and then with the Ghana Health Service, the Ministry of Health, with the Ghana Statistical Services, with the Ghana College of Physicians and Surgeons, and together we actually did this study.
So Operation Eyesight led the first ever blindness and visual impairment so that we have the concrete data to help address the issue.
And so once the results came out, it was actually accepted by all. And I thought this was very, very good, typical example, that we actually made this at a fraction of the cost it would have cost.
that gave us the data that we needed, and also was able to help us measure the impact, and then also look at the enormity of the situation at that time when it was launched. And it was so timely because data, as they say, is everything.
And from that study, we realized that 0.74% of the population are blind. In all, we had about almost 300,000 Ghanaians who are blind. And then we had 1.07% of the population having severe visual impairment. And so putting everything together, it was about 1.5 million people who actually have visual problems.
The blindness and visual impairment study has been the go-to document for the government itself and all other non-governmental organizations working as far as eye health is concerned to plan their programs, and it has also informed the development of the National Eye Health Policy.
So in that sense, they are adding on to the solutions that we are finding for people who have eye problems or who have other conditions related to eye in the country. So they've really supported the country to be able to offer all the necessary support that we can to our doctors and nurses in order to go to the community to help the people who are blind from cataract. And not only blind, but even those with severe visual impairment from cataract.
At the last count, we have trained over 1,000 community health nurses in primary eye care, training for over 70 ophthalmic nurses, 21 optometrists in low vision, and we have helped in the construction of eye health units in a number of district hospitals, support the construction of Wartburg eye services, and we delivered eye health equipment across 35 district hospitals. We are looking forward to declaring more communities as avoidable blindness free to strengthen the existing eye care delivery system in Ghana so that the government or eye health system in Ghana can sustain itself and deliver quality, affordable, and comprehensive eye care services for the population.
Operation Eyesight Universal is different compared to the other NGOs because it's more community-based. The communities that are among the least supported regions in the country where the burden of eye disease are, and that is one thing I like about them, that they go to where the need really is.
This anti-pump was erected in 2008. And since then, this hand pump has really helped us as a school. You know, water is life. And in school, we teach learners the importance of water.
We use water every day. When we drink and wash, we brush our teeth, we wash our bodies. Don't take it for granted. We use water every day, everywhere, all day.
Instead of the school going somewhere else to go and fetch water, we find the water within the vicinity. Secondly, hygienically, this water is very safe. We've never had any experience of any child who has suffered from waterborne diseases. When this hand pump was erected, the school was running from grade 1 to grade 7, and the enrollment was around 200 something. But since then, in the past 6 years, the enrollment has since drastically improved and increased. This water, basically, we are using it in so many ways. We are using it for this orchard. As you can see, we have bananas, we have lemons, and apart from using it for gardening, we are also using it for cleaning the toilets. We have about 5 pit latrines. We also use it to clean our classrooms. Whoever funded this hand pump, we say thank you, because this hand pump is really beneficial to us and to our learners.
We came here to check on one of the boreholes that we drilled in 2008. Since then, it has serviced over 350 community members. Currently, the borehole has dried up, and we want to see the challenges that people from here are facing. So we are walking to the nearest river, which is like 1 kilometer from where the borehole is, because that's the nearest water point that they have. As we are approaching the cold and dry season, this river usually dries up. So we just want to feel what the community has been going through. The community members have gathered and they're happy that we're here. So the need is for us to rehabilitate this borehole. So they are very happy and anxious at the same time because the rains, we usually receive rains in December, but this year the rains delayed. So we expect the river to dry maybe in the next 30, 40 days. So we are hoping this borehole can be fixed at the earliest. We've approached a village called Sikaneka within Mamba district, where we are lucky today to find area pump minders. We have trained fixing a broken down hand pump. This hand pump broke down 2 days ago, and the community here has not had water for 2 days. This hand pump services about 500 animals and 360 plus people of 45, 42 households. So it's very crucial for this hand pump to be working. And I can't wait to see the water coming out.
This baby should have been born at the 40th week. So the whole organ complete development is not happened as yet. And so especially for the eye, the retina and the blood supply to the retina gets triggered. Through the screening of the retina, he's very easily able to identify when there is problems which result in bleeding in the eyes. Babies who are born premature, they are fighting for survival. But it's not just surviving, it's in terms of quality of survival. And this is really where Operation Eyesight and the ROP project comes in. If you miss ROP, you will have a child in the 5th or 6th year who goes blind for the rest of their lives. It's irreversible blindness that is caused.
So in India, there are about 3.5 million premature births already happening, and about 150,000 are liable to develop retinopathy of prematurity. So the ROPE project concept came around 2020 when Operation Eyesight Universal and Cooper E Foundation helped us to set up the ROP clinic.
And one of the critical things that Operation Eyesight has identified that premature newborns are not being screened to the requirement or to the public health need of screening.
The actual outreach was not happening. We were only dependent on the NICUs to send a call and identify patients. Moradabad itself has a population of about 4 million. And we have been able to screen a lot of NICUs and identify about 464 children who were requiring screening, and we have been able to save about 50 children a life of blindness. Actually, the teleophthalmology model is ideal for rural or semi-urban settings. So it is all the more important that we have the team visiting those NICUs, identifying those children, sending those images by teleophthalmology, and getting a correct identification of those children.
So I'm sitting with Mohammed, whose wife was pregnant, and in the 7th month, they found that actually her blood pressure was going really high. The baby was born 950 grams, so it was premature. They screened the baby for ROP and found that the baby actually had first stage of ROP, and that's where he was able to find CL Gupta, where the Operation Eyesight Universal project is being implemented. The baby is in 5th month now, and the baby is doing well, and he's very thankful for the work that is being done.
Baby was approx 1.5 kg.
Okay, 1,500 grams each of the babies.
Our doctor recommended for CL Gupta. He said both have severe ROP. At that time, we were scared about what will happen, and there was a fear inside us that our baby will be able to see or not. I feel so lucky that we came to know at the right time. If we have delayed a month, then there will be no possibility of cure.
So having treated these 50 children, we have realized that this is something which is doable. But what is really disturbing is that in spite of this intensive work in the district of Moradabad, we continue to keep having referrals from surrounding areas of Moradabad with children who have completely gone blind from retinopathy or prematurity. We're really thankful to Operation Eyesight for helping us in scaling up the project to reach out to the surrounding districts.
And Operation Eyesight is committed that no child should go blind simply because they were not able to access screening or they were not able to access treatment once they were diagnosed with retinopathy of prematurity.
I also want to mention that there is no other organization other than Operation Eyesight Universal who is helping out in the field of retinopathy of prematurity. You are filling up a gap that is going to impact the entire lifespan of those children and their families that are going to be affected in their entire life of blindness, which they would be cursed to otherwise.
So right now we are at a location in Roan village, which is in Karnataka. Operation Eyesight has been working with Joshi, where they have been doing the whole community eye health intervention as well as the vision center linked. I just want to introduce two of the beneficiaries, and both of them are now the showcase of what Joshi has done through their Roan Vision Center.
We have been working with Operation Eyesight Universal for more than a decade now. We first started our Vision Center concept at Joshi Eye Institute is with Operation Eyesight Universal. We have healthcare workers, and each healthcare workers cover around 30 houses per day.
And we do a detailed door-to-door survey first to identify all people who have any eye problem.
They don't have to go very far away from that village because it will be very nearby to that village, probably around 10 to 15 kilometers and not maximum from that.
And we hope to be able to instill in the community the importance of being able to identify eye issues and eye complaints early. And once those levels are achieved, then we do the Avoidable Blindness-Free Village Declaration.
Cataract still happens to be the #1 cause of avoidable blindness in India. That is where the Vision Center concept helps. We go to the rural areas, we go to the unreached areas and reach the unreached population. From the Vision Centers, the people are referred to the base hospital who require cataract surgery. So we do around 100 surgeries in a month.
And Operation Eyesight and Operation Eyesight donors are able to partner with people who have hunger to provide quality eye care services in distant locations like this where we are.
So doing this Vision Center concept, it's also about counseling. It's also about bringing in eye awareness. Definitely when your own patients who are not being able to see and seeing the smile on their face itself makes us so happy.
ಖುಷಿ ಆಯ್ತು ಎಲ್ಲ ಕಾಣಿಸ್ತದ ಈಗ
ಮಾಡ್ಕೊಳಕತ್ತದಿಂದ ನಿನಗೆ ಎಷ್ಟು ಖುಷಿ ಆಗಕತ್ತೈತಿ
ನಮಗೂ ಹಂಗಾಗಿತ್ರಿ
She says she was largely in the house itself and she was not able to go out of the house. Now, after the operation, she's able to see, she's happy, and she's able to move around in the village and meet her friends and relatives and everything. And this is a partnership between Operation Eyesight Universal and Joshi. And to achieve this success of avoidable blindness-free families and villages,
we are working hard to make most of these villages, these talukas, these districts, an avoidable blindness-free village, an avoidable blindness-free district, an avoidable blindness-free state.
Operation Eyesight has been very much useful to us and very much useful to the patients of these areas. And that is our aim, to make all people to see, especially the preventable blindness, to be cured.
at the end of the day, we are about saving sight. It's not about color, it's not about race, it's not about language, it's not about nationality.
I'm proud that I'm working with Operation Eyesight because we work in a very remote area where no other eye NGOs, international NGOs, are working. A patient is maybe for 5 or 6 years, he is sitting like that in a blind condition. 6 hours of treatment. When the eye shield is removed, they can see the things clearly. And that is a blessing actually to us.
I think we're finally at the point where we have these models that work, and they're in demand in other countries and areas that we're not working now, that people and groups and governments are approaching us to work with them and are willing to actually pay for the expertise, right? Like that's like the pure definition of sustainability.
We continue to learn through these projects, we continue to innovate, and we ensure that whatever is invested in these projects, we are getting at every level, we are getting higher returns on the investments that are made.
We cannot say that Operation Eyesight can be able to solve all the problems, but we have the technique and the approach to build the capacity of the local people to be able to solve their own problems.
The organization continues meeting with the original goals and the philosophy that was in the beginning.
Well, I don't think any of us envisioned that it would go on the way it has been, and the success it has taken.
It would be proud of what it has accomplished, but say there's still more to be done.
We are celebrating our 60th anniversary today. We have survived for 60 years. In fact, we have not just survived, we are actually thriving and growing. How is it possible that it is happening? It is happening because of the fact that we are a global community, a community comprising donors around the world, the professionals, the partners, healthcare workers, the target communities, and many more. We are the bridge, something that Art and Ben dreamed of those days. So we are keeping their dreams alive, and we would like to move forward in this particular direction.
I'm so proud of Operation Eyesight for the consistent decades of restoring sights, transforming lives, and helping others to see how beautiful the world is.
I would like to highlight one of the potential sentence that was uttered by one of our beneficiaries. He just said, "Thank you very much for bringing light into my darkness world."
What I hope for in future for Operation Eyesight is that it's going to scale up its programs in Africa, more African countries, in Asia countries.
We wouldn't have been able to achieve this without the support from the donors. You continue to provide us so that we are able to put smiles on the faces of the vulnerable in our society.
Every time I tell people where I work, their eyes unanimously light up because they're impressed with the incredible work we do.
Because we are transforming lives every day. We are restoring hope for children who had given up on education, and even adults who had given up on leading normal, productive lives.
Thank you to our global community.
Thank you.
Thank you.
Thank you very much to our global community.